A discreet way to check the level of anxiety of your patient is to shake hands with them when you walk in the room. Now, you're establishing rapport with the patient, which is terrific, but you're also gauging their level of anxiety by whether or not there's any perspiration on their hand. So if they feel sweaty when you shake their hand, it means that they're a little bit nervous to be there. If you need a towel after you do it, then they're a lot nervous to be there. So you can gauge kind of on the wetness of their hand, which sounds gross, but it's a good thing to add into your practice. The next thing, which is very discreet, the patient won't even know that you're doing this. It's a cool tip, something that I do regularly. When the patient comes in with a broken tooth and they say they want it extracted, I'll lean them back in the chair and I'll take a look at it. Everybody does this. So when you lean them back in the chair, what you do is you retract the lip, but you do it with a pinch grip. So you kind of grab here and you feel right there. And what you're doing is you're palpating that labial artery to feel for their pulse. So the patient's not going to know that you're doing this at all. It's super discreet, and you're checking to see if that pulse is really going fast. That means they're pretty nervous about what's going to be happening that day. So that gives you a nice way that you can just sit them up, and then you can bring it up. You can just outwardly say, how do you feel about treatment? Do you feel a little bit nervous about it? Do you feel okay? How have your past experiences been? Open that dialogue and give them a chance to de-stress a little bit and have that conversation with you if they're willing. Some people will deny and just say, oh, I'm fine, nothing's wrong. And that's maybe not the case, but you've done what you can to allow them to express that.